Hello, welcome to my channel. In the next upcoming series of videos, we'll be learning about cysts of orofacial region or oral region. But today will be an introduction, so we'll get to know about what are cysts, what are its components, and its classification. Now let's begin. To know about cyst, it is nothing but a pathological lesion that is majorly seen elsewhere in the body but most commonly in the oral region, and it might be a common cause for chronic jaw swellings. We'll start with definition. Cyst is nothing but a pathological cavity that is lined by epithelium. That cavity contains fluid or semi-fluid material. This definition is given by Schaefer. Whereas the another important definition to be known, it is again a pathological cavity. That cavity contains fluid, semi-fluid or gaseous content, and it is not created by accumulation of pus. This is something you must remember. It is frequently but not always lined by epithelium. To know in detail, cyst is always lined by a epithelium that does not contain pus. That will not contain pus. Whereas, what is the other thing that contain pus that is formed by the accumulation of pus? What is it? That is abscess. We all know that contain pus. Whereas sometimes this is gets secondarily infected. Secondary infected by any infection. These infection causes accumulation of pus in the cavity of the cyst. That time we can call it as cystic abscess. Otherwise, cyst does not contain pus. Okay, this is something you must remember. As I told earlier, if a cyst is lined by epithelium, then it is called as true cyst. Whereas if it does not lined by epithelium, it is called pseudocyst, also false cyst. These another thing you have to know is odontogenic cyst. Nothing but epithelial lining is derived from odontogenic epithelium or is remnants. We all know odontogenic epithelium consists of inner enamel epithelium, outer enamel epithelium, dental lamina, and Earth's-weak epithelial root sheath, and its remnants. We all know dental lamina remnants are called as cell roots of Serrae, whereas remnants of Earth is also called as cell roots of Malaise. I think this is clear regarding the cyst. Then we'll move to components of cyst. This is just an elaborate explanation. It consists of cystic cavity, lining epithelium and wall of the cyst. Nothing but you can see here. As I told, it is a pathological cavity. Cystic lumen or cavity, or a cystic cavity that contains fluid, semi-fluid or gaseous material. Gaseous material is majorly seen in bony cyst. We'll learn that later. The second component is the epithelial lining that you can see here. That is generally derived from the surrounding structure. And the other thing, the third component is the connective tissue capsule that contain collagen material always that act as a wall for the cyst. This is the third component. These three will be the major component in any cyst, whereas lining epithelial can differ. Even cystic cavity also may contain the other material like gas, semi-fluid, or it might be even empty also. I think this is clear. We'll next move to classification of cyst. This is given by Mervyn Schaefer. I feel this classification is easy and easy to understand and also remember, not all but also major cysts. Based on location, these cysts can be classified. First one will be under jaw. that is classified as epithelial cyst and non-epithelial cyst. Under epithelial, again it is classified as developmental and inflammatory cyst. Again under odontogenic, under developmental, it is classified as odontogenic and non-odontogenic cyst. There are some of the cysts have listed under each classification. You can see non-epithelial cyst, solitary bone cyst and aneurysmal bone cyst, nothing but the bony cyst they are. The next is the inflammatory cyst. Under this you can see radicular, residual, paradental, the other things. And the major thing is the odontogenic cyst. We'll be dealing with this. Very important is OKC, dentigrous cyst, nothing but DC, gingival cyst of adults, gingival cyst of infants, eruption cyst, lateral periodontal cyst, botryoid odontogenic cyst, glandular odontogenic cyst, calcifying odontogenic cyst. I think we'll be learning all this in the later classes. Next one is the non-odontogenic. Again, you can see some of the lists of cysts: nasopalatine, nasolabial, mid-palatine, raphe, cyst of infants. Again, globulomaxillary. Again, an important cyst you should know. We'll move on to other classification, other list of cysts and associated with maxillary antrum, nothing but maxillary sinus. You can see these are some of them: retention cyst, mucosal, pseudocyst, post-operative maxillary cyst. Under the soft tissues of mouth and face and neck, you can see dermoid cyst on epidermoid cyst, thyroglossal duct cyst, cystic hygroma, nasopharyngeal, thymic. Again, the cyst of salivary glands, parasitic cyst, and some other cyst you know. The second classification is nothing but histogenetic classification, that is based on histopathology or the histology of the cyst. So if the cysts are derived from cell reds of Malassez, periapical and residual cysts are classified under this. And also dentigrous and eruption cyst is classified under reduced enamel epithelium. And then the other list of cysts you can see here: OKC, GC, LPC. They are classified under rest of dental lamina, and the other unclassified, some of them are paradental and calcifying odontogenic cysts. You must know the classification of cysts for better understanding and also learning. In the next classes, we'll be learning about all the cysts in detail. By then, keep learning and enjoy learning. Thank you.